Hello, I am Dr. Nabasu Lemech Ezra, a consultant urological surgeon and head of urology unit in surgery department, Nisa Premier Hospital here in Abuja, Nigeria. There are several of them. Diseases that can cause male factor infertility can be pre-testicular, testicular and post-testicular. What do you mean by pre-testicular causes of infertility? Diseases that occur in an individual that do not have a direct link with the testicles, but affecting the function of the testicles. Example, diseases of the brain, of the pituitary gland in the brain, diseases of the hypothalamus, diseases that can affect the testicular function, and other things like exposure to radiation and toxins. Diseases directly affecting the testicles can also affect testicular function, like inflammation of the testicles, like recurrent testicular torsion, or failure of descent of the testicles. That can lead to male factor infertility. The other arm of it is obstruction. That's obstruction of the outflow tract of the testicles from anything, whether it's acquired or congenital. And this may be due to trauma, surgery, or infections. Oh, yes. If you look at the causes of infertility, generally, smoking has been found to affect testicular function in the long term. In chronic smokers, it has been found to actually affect testicular function. Causes of erectile dysfunction are also many. We can classify them into two mainly. Psychogenic causes. These have to do with the person's state of mind. Anything that affects the person's state of mind can affect the erectile function of the individual. Or organic. If we say organic, we mean the individual has a disease condition that is affecting the sexual organs, the nerve supply, the blood supply, and other parts of the sexual organs, thereby affecting testicular function. Example of them is chronic diabetes. Diabetes mellitus affects nerve function and vascular function. If left untreated for a long time, it can affect those organs and thereby leading to testicular function. Another example is drugs. So once we can identify a cause of erectile dysfunction, a specific cause from a disease condition in that individual, or the person taking some medications that are affecting the erectile function, it is called organic. Sometimes it may be a combination of the two, psychogenic or organic. It is generally accepted that a couple should try to conceive for at least a year, but there are exceptions to that rule. If some observations are made by the couple, example, some obvious problems that may lead to infertility, like swellings in the scrotum of the male partner, chronic pain in the testicle of the male partner, or any other condition that they have observed, absence of the testicle. Once that is observed, we don't have to wait for 1 year to see a doctor. We can see them earlier. But generally, it is acceptable that 1 year is the duration a couple should wait before they seek medical advice for infertility. Oh yes, vasectomy, as we all know, is the interruption of the channel of flow of semen. That can be reversed in the future, and that is done for the purpose of achieving contraception. It can be reversed in the future using surgical techniques, microsurgical techniques. But this is not is not always successful. Sometimes it may be unsuccessful. So yes, the answer is we can reverse vasectomy and still help those couples achieve conception naturally. Yeah, I've heard of that several times. It's rather a misconception that people have all around. Wearing tight shorts does not affect sexual function or fertility function of a man. It's one of those things that we've mentioned, testicular causes, pre-testicular and post-testicular causes. It is not one of them. Once you identify a problem you have tried for a year, or you identify a problem within you that requires attention, you just seek consultation with a doctor in order to examine you and see what the problem is. Boosting fertility actually depends on what is causing the infertility. Some of the causes are treatable, some are not treatable. Some are treated with drugs, some cannot be treated with drugs. So it is best decided when examination and investigation is done before we can know whether something can be done to boost the fertility or not.